My name is Patrick Phillips. I am the CEO and the founder of American Business Systems. And yes, this is our 25th anniversary. That's right. You can tell by looking at the picture of me there that I've been around for at least 25 years. And I am just thrilled that you guys are on the webinar today. We could change your life. As you saw from the slides that we were running there as we were getting started, we've got dozens and dozens and dozens of people that I've done interviews with that you can watch the replay of those interviews. They're usually about an hour long. And we go into detail as to how they started their business, what they like about the business, what they don't like, what is scary about the business, tips on how to succeed in the business, how they got their first client, and just all kinds of stuff. You can find that, by the way, on our website. You see that at the bottom of the screen? absystems.com. Just go look under the news tab and then go to the blog and then start scrolling down and looking at all the entries there. By the way, I'm also a best-selling author. I've written some books that are out there on Amazon.com and in some of your local bookstores, so you'll see those out there. And I'm also on the editorial board of BC Advantage. Now, that's a print magazine. 40,000 people subscribe to it. Everything from doctors to office managers, medical billing people. And so I'm on the editorial board of that magazine and have articles in there on a regular basis as well. I'm also on the board of MIRMA, which is the Medical Revenue Management Association of America. You can find out more about that there at mirma.org. So I don't see anybody typing in the question box. Could somebody type that in there and let me know that you're actually hearing me? I don't know if anybody's listening to me right now or not. Maybe I'm just talking to the air. This will be a proof positive that if I see somebody typing in there, that you're actually listening to the sound of my voice. Okay, thank you, Francie. Francie says yes. Karen, Cynthia, Michael. Okay, good. I just thought maybe y'all had gone to sleep already. All right, let's talk about American Business Systems. We've been doing this for 25 years. So what have we been doing? Lupe, thank you. And Jasmine, I see y'all's comments there as well. Well, we've been teaching people how to do medical billing for doctors. That's really what it boils down to, but it's way more than that, as you'll see from this webinar. Now, folks, today I'm going to be showing you about our online cloud-based system and how we can train you to get up to speed on this just real fast. It's not brain surgery, and it's not rocket science. And yes, I'm going to be recording this today. So by the way, you'll get a link by email by this time tomorrow with the link to the recording of this too, in case you want to share that with somebody or you can't stay with it the whole time. All right, so by the way, our system includes not only a practice management system, which is what you actually do the billing with, but an electronic medical records system as well that the doctor can utilize on their iPad or their tablet. They're in their office and their staff can access it as well. And it has all of the codes built into it. Yes, if you're wondering about medical codes, there's lots of them, thousands of them. That have to do with the procedures and the diagnosis and so forth. Those are all built into our system, so you don't have to worry about those. We also have a clearinghouse. That's right. It's built into our system. We're the only online cloud-based system that has a clearinghouse built in. We don't send it to a third party like most medical billers have to do and depend on them to clear the claim and send it on to the payers. We do all that. We scrub it all, and we submit those claims ourselves. We also have a patient portal. Those of you going to a doctor anywhere in the last 5 years have seen that that is the future, having a patient portal. Ours has everything that has to do with that patient right there available for them to log in anytime from anywhere. By the way, there is a printout of today's slide deck. It'll be in the handout section. Clever, right? The handout section of this go-to webinar control panel that's there on your screen or hidden behind some of the windows that you have open of YouTube, videos of cats playing or whatever it is that you're doing right now. Go look for that control panel in the handout section, and you'll see that I've already put that in there. So all the slides I'm going through today are right there. Now, I'm going to start with a real important one, by the way. If you're wondering how big this market is, folks, physician and clinic services spending is currently $614 billion, that's with a B, every year. Folks, this is 1/5 of our entire economy. That's right. If you're looking for a business that has some kind of future to it that you think might be around a while, believe me, the healthcare industry is the industry to get into. And you'll notice there on this chart, slide that there are all sorts of types of things that are happening in the medical healthcare industry. And we are that red bottom right-hand corner there. Let me see if I can get this little pencil thing here going. I'll see if I can circle that for you. This is it, right? Oh no, that did not work. That did not work. I'm so sorry. I don't know what I'm doing, obviously. So I'm going to go back to the pointer here, and I'll just point to it. Can you see my arrow there pointing around? That's the physician and clinical billing that we're talking about that you can do for any of the physicians in any of the dozens of specialties that are out there in the medical market. And so you'll be able to do the billing for them. We also have available hospital billing for those of you who think that that's a market that you could go after. We also have dental billing as well. And that's a very small piece of the pie. As you can see down here in the corner, dental services are only 4%. Because, hey, let's face it, nobody wants to go to the dentist. Go in a dentist's office, you won't see a whole crowd of people there, right? You only go if you have some kind of problem or pain, right? And not many people have insurance for dental as well. So it's not a very big market. We don't encourage our licensees to go after that market. First of all, sign up all the doctors in your area that need your help, and then you might want to go after the dental people that are out there as well. Okay. Now, somebody is asking a question here I'm going to address right now. With all the slides that we're showing before the webinar, will they be included in the replay? You know, I think they will be, Lupe. If not, get back with your business development rep here at ABS, and they can make sure that you get those slides if you want to see those. Okay. I went by that slide way too fast. Let me just read that quote here that you see. The market for medical claim billers is growing exponentially, and with legions of providers and an ever-expanding patient pool, healthcare industry spending is expected to grow by 5.8% each year through 2024. Now, that doesn't mean it's going to stop or get smaller. Folks, listen, think about it. More people being born every day in the United States. As long as there's human beings that get sick, that have to go to the doctor, and the doctor has to get paid, somebody has to do the billing for that doctor. And this quote is right out of Entrepreneur Magazine's book called Start Your Own Medical Claims Billing Service. A great overview of the industry. It's not going to tell you exactly how to get all the details of how to get it done, but it's a good book. It's a good reference. You might go out there on Amazon and order it, and you'll see that quote in there. It also says by then, they're talking about 2024, healthcare spending will total 5.43 trillion and account for 19.6% of the gross domestic product. That's right. Our GDP, it's almost 20% of that, as I said earlier. Healthcare is big business, and its growth shows no signs of slowing. This makes it the perfect time to start your own medical claims billing service. All right, folks, by the way, in the back of that book, we didn't ask for it. We didn't pay for it. It's just there. There's a reference to our company, and you'll see that they're recommending us when it comes to finding a company that can help you get started in this industry. Since we've been doing this for 25 years, we kind of know what we're doing. We kind of have some experience in this. So basically, folks, we're going to be training you to become what's called a certified medical revenue manager. Now, that's our own certification exclusively for our licensees, and it entails way more than just managing the billing for a doctor. It has to do with what they call their revenue cycle management. You see it right here on the slide? Revenue cycle has to do with everything in that practice that brings in revenue, money. Yeah. And management is, who is it that can manage this? Well, we're going to train you to be the person who can actually do that managing of that entire revenue cycle that you see illustrated here on one of the brochures that you'll have available for marketing. By the way, these brochures are very nicely designed, full color, and there's always a room there for your contact information that you can have custom printed on these flyers as well. At the end of the training, by the way, that we do for new licensees, we certify you. That's right. We have a certification with this certificate that you see here with your name on it that says you are a certified medical revenue manager. That's through the MIRMA organization that I mentioned earlier. My son, Adam, is the founder and CEO of MIRMA, and we'll be glad to tell you more about that as well. Okay, so what is revenue cycle management? Well, this illustration here shows you exactly what it all breaks down to, from the patient registration to the insurance eligibility, patient appointments. All of that is the start of a medical billing claim when you walk in the doctor's office. So you see, our system being a cloud-based system, you can give access to the people in the doctor's office so that they can actually get into the system and start that process of doing the patient registration for you. Otherwise, most medical billers have to put in that data, that patient data themselves, not you. You can have this front office staff do that up front there and check for insurance eligibility. That's very important, folks. The doctor doesn't want to see a patient if they're not going to get paid, right? And the only way to know that is if they have insurance, if they're eligible. And our system does that in real time. That's right, in real time, meaning connected to the internet, going through the internet, it goes and looks at the patient's insurance eligibility with that particular insurance company and comes back and says, yeah, they're eligible. That saves a lot of time and brings in a lot of revenue that the doctor might not see otherwise. Then, of course, there's the claim submission. That's the charge entry, the medical coding, and the timely claim submission that you will have access to through the IClaim practice management system. Then there's the claims management. Once that claim has been sent off, of course, you need to be able to track it when the payment comes in. All that can be done in our system. And then, of course, we have all the medical coding services that are available through ABS for you, so you don't have to go get certified as a medical coder. All the denial management is built into our system, meaning 34% of all claims that are sent from doctors' offices or most medical billing companies are denied. That's right, denied on the first submission. And ours is less than 2%. So that's why our system is the leading edge high-tech system that's out there. Then there's AR management, of course, has to do with the accounts receivable. That's what that stands for. The follow-up, the patient collections, the patient statements, all that's done through our system, folks. And without you ever having to make a phone call, it's all done automated through our system. Then there's the analytics. The doctor might want access to our system to see all about everything that's happened behind the scenes. So there's reporting available to the doctor. All right, I see some other statements and questions that are coming in here. And let me see if I can look at some of these. Okay, I think I've covered all the questions so far that are in there, but I am looking at that. If you want to type something in there, I'll be glad to monitor that as we go along. Now, IClaim is just the name of our practice management system. Folks, we are powered by NextGen. NextGen is the world's largest provider of medical billing software, and we have our own private labeled version of their software for you as an ABS licensee. It gives you real exclusivity in your area. When the doctor sees this, they think of this as you tied to, of course, the American Business Systems system. So as you can see from this screenshot, it can run on any kind of computer, Windows, Mac computers, even a Chrome laptop. It does not matter because it's browser based. That means you literally log in, going to a website link that we give you, you log in with your credentials, and then once you're in and you're using it. Yes, you could use this from a McDonald's that has a Wi-Fi connection with your credentials because our system is HIPAA compliant. So it's very safe. This is one of the marketing brochures, again, that tells about the service. As you can see, room down here for your name and contact information to be printed on that. So what is IClaim? Well, when I call it a practice management system, folks, it means that it has everything in there that's needed for the front office people to be able to put in the data for each new patient. It also has your data in there so that you can access it for the billing purposes, for the billing. You're the billing company behind the scenes that is logging into that system. And then we even have the electronic medical records, which is available for the doctor that they can use when seeing the patient. I'll go into a little bit more detail as we go along through the slides here. Here's the IClaim system. We're just showing you again a brief kind of a few screenshots here of it so you can get an idea of this, because folks, what this boils down to is we're selling to you a complete package, what we call a business opportunity package, which includes training. And that training is live. It has a 100% money back guarantee, as you'll see towards the end of the webinar. I'll read that to you. And that means that you have no risk. Now, our license fee for all of this training, there's hours and hours of training on our licensee website, which I'll also show you. But basically, all of this and lifetime support and all the marketing materials that we're going to provide to you. All of that is a license fee of about $27,000. Now, the reason I'm giving you that number up front, because I want you to know that there is an investment. This is like a franchise, except we don't have any royalties, no ongoing royalties of any kind. You don't owe us anything. You never pay ABS anything after that first initial investment. And there is some financing available for that. For those of you who are interested in that, you'll have to get back with what we call your business development rep here at ABS. And I'll give you our phone number here towards the end if you don't have that available in one of the emails that we've sent you. But as you can see, we're showing you here that how simple it is. You take the numbers that are circled by the doctor or their staff when they see a patient, and you put that right in here by just clicking on Create a Claim, like you see here on this screen. You'll also have patient information, of course, sometimes given to you. Sometimes that's given to you by the office. Other times the office is putting that in there, depending on whether they want to do that from the front office. Then, of course, you put in the claims information, including the codes that the doctor has circled. This is all stuff that, I mean, we're showing pieces of paper here, but this is all sent to you electronically. There's no paper. You can be a completely paperless company at this point with the internet and with the way that we've set up our system. So you're putting that in, basically, those two pieces of information, and boom, you've got a medical claim that the doctor can get paid from. Now, this is the main screen looking at IClaim. And as you can see, we've taken this picture just so you can see a picture of what you're working with. Very user-friendly drop-down menus. The training on this is phenomenal, folks. We're going to guide you step by step through this because we have the technology to get online with you and show you live what this is all about. By the way, if you'd like to see a demo yourself of this system, our software doesn't come on a CD, so we can't mail you out a CD to put on your computer. We will get online with you one-on-one and go through it with you, answering all your questions about the system. You'll notice that all the ICD-10 codes, those of you who are familiar with medical codes, those come out and are updated on a regular basis, but they're all built into our system. So the doctor doesn't even have to guess as they're putting these codes in, are you or the staff there at the office is putting them in as well. And then, of course, once you put the name in, the code, the name of it, the actual description of it appears automatically there to the side of it. This is where you put some more codes in called the procedure codes. This is what the doctor did to help the patient get well. And it's real simple. That's filled in with some dates, as you can see it doing there right now automatically. I've got a ghost typing for me here. And once those are put in, that's it. You're done. That is a claim right there. You will basically click the Create Claim button that you see at the bottom here. And folks, this goes in real time. I say that real slowly, but it's really very fast because it's across the internet. Immediately goes into our system, into our servers that are located in 3 different locations in the United States. We did that purposely in case one of them goes down, the other one just kicks in, you'll never know it. And so we have the ability to get that claim sent electronically. No more paper, although you'll find when you go out and start talking to doctors that a lot of them are still using paper. All right. Oh, that's one of the questions that Brad just asked. What happens when this system goes down? Would we have access to this system for life? Yes. Once you pay that one-time licensing fee I mentioned earlier, Brad, you are a licensee of ABS and have access to the system for life. Now remember, NextGen powers our system, so even if ABS went out of business, which again, we've been in business for 25 years, no reason for us to go out of business now, that is still your assurance that you're always going to have access to the system. And by the way, the system doesn't go down. Brad, I know you find this hard to believe. If you're in computers, you know there's always some downtime. Ours is like 99.7% uptime, which means it just doesn't go down to speak of. It's not, practically speaking, it does not go down. Now, we take it down every once in a while to do some complete upgrades, and we want to make sure nobody's on the system, but we'll give you plenty of notice of that. That's usually about 3 a.m. in the morning that we do that, and it's only down for maybe 20, 30 minutes. So it's very safe. It's backed up off-site out of those 3 locations that I told you about. From those servers, it's backed up nightly. And folks, this is HIPAA compliant. What that means is the government has looked at our system and says, yes, you are as compliant as you need to be for patient data, privacy, backups, and so forth. Anthony says, are we able to get date from the office and send back information on what will work for their office? I think you put the word date there, Anthony. I think you meant data. Yes, one of the things we teach you to do, Anthony, is what's called a practice analysis. We've got about 40 questions that you can ask the office staff that finds out where they're at and whether or not this will work for their office. Then we'll help you from the answers they give you develop what's called a proposal to go over with them and show them how you're going to help them. Usually, you're going to save the doctor a ton of money, and you're going to save them a lot of time as well, of course, by doing the billing for them. Okay, I think I've got all those so far that have been asked. I'm going to delete some of those questions as I answer those. Yeah, okay, thank you, Anthony, corrected there. Okay, and let's see. Tamara is saying 27,000 for the software. Is that once or every year? Tamara, I didn't make that real clear. I'm assuming that you've gone to our website maybe and seen what all's included in that for the $27,000. You get a lot of marketing materials. You get access to our lifetime support and our private website for licensees, which I'm going to show you, by the way, live here in just a moment. Plus, you get, of course, access to our system for life. There's no upgrades fees. There are no downloads of new things. Folks, this is all cloud-based. So when you log in, you're looking at the latest enhancements to our system always. It's kept up to date always. And you have free access to that as long as you're, an ABS licensee, which is hopefully the rest of your life. So no, there is no ongoing fees for updates. Hey, by the way, there are other companies who do something similar to what we do. Yeah, you'll find them out there. They'll say that they've got a training package and support and software. Some of it's, by the way, on CDs. Can you imagine? It's that old a technology that is sent to you on a CD that you install. Hopefully you still have a CD drive right on your computer, and you install it on your hard drive, and then it sits right there. And so does all the patient data. Very dangerous, folks. In today's world, you don't want any of that patient data on your computer. You are breaking all kinds of HIPAA rules probably by having that in your office, unless you're backing it up and storing it off-site every single night. If somebody steals your computer, they've got all that, right? If there's a fire, it's all gone. With a cloud-based system, we are in control of that data, and we're making sure that it's backed up and always available to you. So anyway, I kind of got sidetracked there. Okay, so here's the EMRX. As you can see, we're showing an iPad there. That's because you can actually run this on an iPad. Now, let me show you something. I hope I still got it running here. This will be embarrassing, won't it? I'm actually turning on my webcam here so you can see this. And yeah, there it is right here. Look, I've got it running. I don't know if this is going to show up on the computer monitor here or not. Let me see if I can get that in the camera there. There's our system running on the iPad right now. I'll show you that it's live because I'm going to touch one of these buttons here, one of these little choices up here. There you go. As you can see, it's going to the EMRX right now. This is what a doctor can actually use in their office. Now I'll go back to the slide there so you can see this and turn off my ugly mug here. There you go. You'll notice that those buttons are oversized because they're made for adult fingers to be able to tap on those buttons. Yeah, and it's all written for so that it looks exactly like this on any tablet, any computer, any iPad. It's always going to look the same. So it's been programmed to look exactly like this, and the doctors absolutely eat this up. They love it when they see this. So to summarize, electronic medical records is what EMR stands for. It's a cloud-based, all-in-one certified EHR technology. That's also another term used, electronic health records, that's fully integrated with IClaim, meaning everything that the doctor does inside this system on their iPad when they're seeing the patient, anything they do in there to record things about the visit with the patient, it's all in our system available for you to go ahead and do the billing for that visit behind the scenes. That's what you're doing, is taking that off of the doctor, off of their staff. They don't have to have software. They don't have to have an IT guy. They don't have to worry about this because that's not their focus. They should be focusing on what? Seeing patients and taking care of patients. Anthony says, do I or my team need to have a degree in medical billing? No, Anthony, that's what we're saying is for that one fee, that one-time fee, we're going to train you and yes, your staff, if that's what you need, to get up to speed and know everything you need to know about medical billing. By the time you've gone through our training, which is live, by the way, with live instructors, you know more than 99% of all the medical office managers out there. Yeah, so you do not have to worry about that. No, you don't need to go to college or get any kind of a degree or certification or medical coding certification or anything like that, folks. It's all a part of our training that we get people up to speed. We saw from the slides that I was showing before the webinar started that we've got dozens and dozens of testimonials from people who've started this business and are very, very successful. Okay. Well, there's another screen of EMRX, just so you can see kind of what it looks like there as the doctor is actually putting in some of the codes there, picking things right on the screen. It guides the doctor right through what may or may not be wrong with that particular patient. It also has a scheduler built into it, a patient tracking system that the front office can use to set up those people and get them into the rooms ready for the doctor to see. So folks, they just absolutely love this. Hey, have you ever had a doctor walk into your to see you in a patient exam room and they get out a laptop and they turn around and they set it on the counter and they're turned away from you because they've got to put stuff in, right? Not with this system. Imagine the doctor standing right there in front of you. Let me get back to that screen where it shows that. Here's the doctor you see facing you, talking to you as he or she taps and puts things into our system using their iPad. It's the coolest, most high-tech thing, very personal. All that other stuff, any computer other than what we have is very impersonal. All right, so here's some more screenshots just so you get a feel for that. Remember, we'll go through a demo with you one-on-one. That's right, a live person here at our office will go through this with you one-on-one. We call them our business development reps. They're here. I'm going to give you our phone number here towards the end. You can call them and say, I want to see a demo of that software. And folks, this is not a sales pitch. We're not going to get on there and try to close you and get you to spend money with us. If you don't think that this is the right business for you, we don't want your fees. We give a money back guarantee. So we couldn't, if we lied to you, can't you get your money back at the end of the training? Yeah. So you don't have to worry about that. We're not going to try to sell you. We just want to show you how cool this is. And you will be just like the doctors when you see it. You'll be blown away. By the way, our electronic medical records connects to all major labs. The doctor can view and order the lab results right through their iPad or computer. Automatic upload to the patient chart, automatic notification to the provider dashboard. It, again, is the high-tech way for a doctor to run their practice. And it's available from any web-connected device. That's right, the doctor can actually do everything on their cell phone if they want to. It checks for drug interactions, allergies, dosage levels, and all duplicate prescriptions in real time. The dosing calculator is built in. The favorite drugs and signatures are all remembered. The doctor will love this. And hey, I see those little hearts going up as some of you are tapping the hearts on your iPads and iPhones as you're watching this. Thank you so much. That means a lot to me because it means, well, first of all, you're listening to me and you like what I'm saying. Okay, there goes another one. All right, so back to the training. Remember, we're going to train you on every aspect of this business. You will have training from a live person, and that instructor is trained and certified to be training you. In other words, they're using the system themselves, and they know every answer to every question you can ask them. You can't ask a question that we can't answer. This training includes, of course, showing the doctor how they can use touch and talk. They can dictate their notes right into their iPad, or they can type them in if they want to. Okay, now folks, let me just talk about some of the other ancillary services, we call them. These are other services that you can offer to your doctors in addition to the medical billing. So you see the EMRX and the IClaim there. I think it's hiding behind my question box here. Let me move that. Oh yeah, here's IClaim up here, and here's the MRX. But look at all these other things. Yeah, Compliancy Guard, Quick Collect, iDocs. I'm going to tell you about some of these. But what I'm saying is these are ways that they help you get in front of the doctor. What if you walk into a doctor's office and say something like, I want to talk to you about your medical billing, and they go, not interested. Maybe they're doing it themselves. Maybe they got their own staff doing it. They have their own software. They spend a lot of money on their own electronic health record system. They're just not interested. Now, does the conversation end there? Nope. Well, it would if you didn't have these services, but with our services, that conversation can move on into other things that they may need help with. And I'll show you some of those as we go through them. Here's one, coding and audit services. Now, I told you earlier, you don't have to become a certified medical coder. We have certified medical coders that can help you with any coding questions you have. And basically, you can go in and scan the doctor's medical charts, a sample of them, up to our coders work queue. Those coders will look at those and then get back with you and give you a report on whether the doctor is over coding or under coding. Now, here's what I mean by that. If a doctor, let's say a doctor's visit is only 15 minutes, but he's coding as if it were a 30-minute visit, that's over coding. You see, he's trying to get paid more than what he should be paid. That's over coding. The doctor can be fined up to $10,000 for every one of those codes that they've overcoded. Now, what if they're undercoding though? What if they really do see a patient for 45 minutes and they only bill for 15 or 30 minutes? They're undercoding. That's just as bad because the doctor's leaving money on the table. Our CodeWrite service can solve that. And look, it says right here, improve your reimbursement rates up to 30%. Now think about that. Let that sink in if you were a doctor. What if your reimbursement rates could increase by 30%? Yeah. Now Karen's asking, is there a charge for the coders to review the doctor's coding? Yes, there is, Karen. However, we teach you to pass these services on to the doctor. See, instead of hiring that $40,000 a year person to sit in their office and know all the codes and maybe work 2 hours a day, the doctor can pay you through our services to have our certified medical coders give him the information he or she needs. And it's very inexpensive compared to hiring somebody, full time for that. So again, don't have time today to go into all the details about that, but just trust me that most licensees charge a fee to the doctor and mark it up. They make money on these services. Okay, she says she's got it. All right, Audit Guard, there you go. This is another way, folks, that we can review the doctor's charts and identify possible coding errors. You see, Medicare sends out what they call auditors. These are independent companies, by the way, third-party companies who have a contract with Medicare to go out and find out if the doctor is miscoding things. And that's where those $10,000 fines come in. This service guards against that by letting us do that review ahead of time. So if the auditors ever do show up, we just turn all that over to them and say, we've already been audited, as you can see. Another great door opener for licensees. When you talk to the doctor's office, you'll be surprised how many have never thought about those fines from Medicare and how these services can help with those. Look at the reports that you can give to the doctor. We go through their charts and put them in and show these reports to them, and they are blown away sometimes because they're either vulnerable to those audits or they're not. And again, Audit Card can help with that. Quick Collect. Hey, do you know that doctors only collect about half of everything that they bill to patients? Well, guess what? We can collect up to 41% of that money that's due that the doctor was leaving on the table. And we are not a collection agency. We don't use the tactics that collection agencies do. We keep the patient happy, thrilled, and ready to pay. And so again, this is an online automated system. You don't have to do anything. You just institute it in the doctor's office, and yes, you make money on these services. Now, it's not as much as you make on the billing. The billing's where the big money is, folks. Look, if a doctor is billing $100,000 a month and you're charging, say, 6 or 7% of that, which is typical, that means you're making $6,000 to $7,000 on that one doctor in a month's time. Now, some doctors are not billing $100,000, of course. They could be billing, $50,000 or $30,000 or whatever it is. But you're making a percentage of that because that's the way it works when doctors outsource their billing. They're used to that. They've heard of that, and they know other people are doing it. And that's the kind of money that's big money for you, because it happens month after month after month. But all these other services, you make some money on them as well. Hey, it's better than a poke in the eye with a sharp stick, right? We call it mailbox money. You literally get this money dumped right into your bank account by us every month. Choice Pay is another service we have designed to collect and process the patient out-of-pocket payments quickly and cost-effectively. Folks, do you know how many people are actually having to pay more and more? Patients are paying a portion of their bill that the insurance doesn't cover. And there's, of course, self-pay people out there too, like myself. I don't have any insurance, so when I go to the doctor, I have to write a check or put it on a credit card. This allows the patient to make choices that gives them options, so they don't have to worry about paying a big $300 or $500, charge right up front. It's called accounts receivable services. Yeah. Then we also have a document management service. Now, folks, this is not just a storage like Dropbox or OneDrive or some of those other places where you can just drop in some documents. We take the doctor's documents and scan those in from our web-based HIPAA-compliant document management system. This allows the doctor and the staff to access those from anywhere in the world on any device that's connected to the internet. And yes, they can search by words that are in the documents. Again, you'd have to see a demonstration of this to understand how important this is. If you come to our offices and visit us here in Fort Worth, Texas, you can ask to see our file cabinets, but you won't see any because no paper is in my office. Everything that comes in is scanned and put into iDocs now, and we can find it, again, very easily from any computer or iPad or phone that there is. Oh man, I'm going through this fast, I know, but look, it's 4:38 already. I'm trying to get through all this and answer your questions at the same time. I hope I'm doing a good job. Give me some kind of comments in the question box if you think I'm going too fast, too slow, or do I sound like a salesman? Do I sound like I'm a real person? My wife will tell you I'm about as real as they get. Okay, thank you, Tamara. She says you're doing great. Now, Karen says, do you say that our payments from the doctors go to you and you transfer the money into our accounts? No, Karen, I'm sorry if you got that impression. I did not mean to give that impression. All the money that's the doctors collecting from the insurance companies and from Medicare and from patients, it's all sent directly to the doctor. You never touch the money. What you know, though, through our system is what is collected. And that is what you base your billing. So basically, you're going to go into something like QuickBooks and just generate an invoice, or any of those invoicing programs that are online out there that are free. Even you can just generate an invoice and say, hey, according to our system, if you look it up, you'll see that we billed for you, $450,000 last month. So we're going to charge you that 7% we told you we were going to charge you, and that's what will be put on your credit card or taken right out of your bank account. That's how most licensees do it. They tie in with an ACH in the doctor's bank account. Yeah. So no, you never touch any of the money. Now there are companies out there who recommend that billing companies do that. We do not recommend that. That's not a good practice. Okay, Compliancy Guard is another one of those services that simplifies the compliance tracking for HIPAA risk assessment requirements. Now, all that means, folks, is this: the doctor is they're very open to being audited for HIPAA compliancy. HIPAA, the thing that talks about privacy of the patient and so forth. And that's something the government came up with that all doctors have to be very careful with. Well, guess what? 74% of all medical offices are not HIPAA compliant in one way or another. This is another great door opener. I can tell you that licensees have used this to get the attention of an office manager, and that's all they walk in and talk about is who's your compliancy officer with HIPAA? And of course, they look at one another like, what's he talking about? There's no such thing here in our office. And we tell them that we can help them with this. That gets their interest. They let us talk to them about this. And guess what? Once you're in the office, past the glass, that magical, piece of glass there that keeps you out of their office, once we get you past that glass, You're a part of their practice now. You can become their friend. You're offering something that's very useful, practical, and can protect the doctor from huge fines. And once you're in there with that, guess what? They'll start sharing with you, and you can share with them marketing materials on your billing and eventually get that too. Okay, Brad's asking something about when's the next 5-day training. Now, Brad, we've actually changed that around a bit. You want to get back with your business development rep here at ABS and ask them about that, because we're going to let you get started as quickly as you want to get started with the training. That's right. We have figured out a way to do that. And so be sure and get back with them and let them know, hey, I'm ready to get started right now. And within just a few days, you can be starting your training. That's how easy it is. Okay, let's see. Okay, now we're going to talk about marketing training. Now this is the hard part for some people to wrap their brain around. Look, learning how to use software, anybody nowadays, it's made to be very user friendly. It's not brain surgery again to learn how to do the medical billing part of it, but how do you actually build a business? Well, you have to get clients. That's called marketing. Folks, no matter how you cut it, you've got to get doctors interested in your services. We have ways of doing that way beyond anybody else that's out there. Why? Because we've been doing it for 25 years. And we've developed tools, professionally designed marketing tools that will show you how to get past that complacency that's there. Doctors' offices got a lot of stuff going on, right? The office managers have a dozen different things that they're doing each day. Nobody has time to talk to you. So we're going to show you how to engage with doctors through about a dozen different marketing methods. Now, it includes some of the marketing materials that you see here, including those books that you see. I'm going to talk about those here in just a moment. We've got, of course, presentation folders, postcards, full color flyers, all kinds of tools that are available to you, even trade show displays that we've actually had designed for you if you want to do a trade show. Anyway, I can't cover everything in this webinar here. We're at 4:43, but I'm going to move right on and say that any doctor that's out there in your area, folks, anybody, any provider, they're called providers because some of them are not doctors, they provide medical services and they can bill on what's called the CMS 1500 form. That's a form that the government came up with, basically that it's a one-page form, and the doctors who are using paper, that's what they use, even electronically. If you can find a doctor who's billing on that form, which is all of them that are out there except for hospitals and dentists, then you can do the billing for them. Okay, let's see. Centil, I see you have another question here. I'm going to address that here in just a second. Okay, so let's talk about that marketing training. You're looking for what do we call power partners. Now, folks, here's what that means. These are people who target your same market. That is, they sell some kind of product or service to doctors' practices in your area. You can probably think of some of those, can't you? Pharmaceutical reps is what's illustrated here, but that also includes, of course, people like people who sell rubber gloves and cotton balls and equipment to the doctor, diagnostic equipment. All those things that are marketed to doctors, those are your power partners. We're going to show you how to find those and connect with those people in your area. Why? Because they're not competing with you, but they market to the same market. Does that make sense? And once we show you how to do that, your marketing is done. I mean, literally, all you have to do is know how to connect with partners who will introduce you to doctors, and then boom, you're in. Because doctors do business with people they know, like, and trust. Well, they know and like and trust this person, you see. She looks very trustworthy, doesn't she? And because they like and trust her, they will like and trust you as well. So that's one of the ways that we teach, is connecting with the power partners. Now, I went over that real fast. Believe me, we go through a good 30, 45-minute session on just that. I've already mentioned the professional marketing materials that you can all have personally printed with your name, logo, contact information on those. They all look and feel alike, don't they? That's because we want people to think of you as, folks, this is as close to a franchise as you'll get. Most franchises don't have this kind of stuff. And we have designed all this for you so that you don't have to design it and come up with it from scratch. Could you start your own medical billing business on your own? Yes. My wife and I did back in the late 80s. We're not in the medical billing business now. We teach and train you and other people, but we did learn on our own that if you don't have professional looking, nice quality, slick, full color brochures and things, the doctors won't have much credibility in you. And it's all about trust, right? So we're going to position you through our training as what's called the subject matter expert. Now, I know you don't feel like you're an expert right now, but folks, with our training, we are going to make you the expert. That's because of the way we position you in using our marketing materials. One of the things we do, for example, is we have a doctor, Dr. Vicki Rackner, who's written many, many books. You can find her all over the internet. She speaks for doctors' conventions all across the country, and she's been interviewed on CNN and the Wall Street Journal and all those magazines and things you see there on the screen. Well, the point is we have partnered with her, and guess what? You're going to be partnering with her as well. That's right. We're going to put you on the front cover of one of her latest books that she wrote with me. It's called The New Thriving Medical Practice. I mentioned that earlier. Look, I'm going to stop this just for a second and turn on my webcam. Look, here it is right here. I have it live. Live, you're seeing the book. And now this one doesn't have anybody's name below ours down here, but as you can see from that slide, I'll put it back up there. You can put your name here because you can be the person who actually wrote the foreword to this book. So it's a paperback book. It sells on Amazon for $24.95. You can go look it up right now. You'll see it's out there. And guess what? We use this as a marketing tool. You can have these books printed. Let me put that slide back up on the screen there. With your name right down here at the bottom. See it there? Your name here for $4 a copy. That's right. That's our actual printing cost in small quantities. Yeah. And so with your name on the front cover and on the inside, you'll notice right here, we've written the foreword already. It's very generic. You could write your own if you want to, but you'll like the one that we've already written for you. And look, your contact information is right there inside the book at the end of the foreword. Folks, it doesn't get any better than this. It does not get any better. Why? Because doctors trust other doctors. And when they read a book that's written by a doctor that you're associated with, you see your name here? Look, your name is not Susan Smith probably, but if it was, it would say Susan Smith, comma, CMRM. You remember what I told you that stood for? Certified Medical Revenue Manager. That's your certification. And you can put that on all your business cards and your literature because you are going to be certified by ABS. Okay, I'm moving quickly here because we only have about 12 minutes left. Automate your marketing with sales reps. Folks, there are people who sell to doctors right now in your area. We're going to show you how to find those people, how to interview them, how to hire them, how to train them, and how to pay them. And I'll just boil it down to this. You pay them on commission only. That's right. Now, there is a setup fee for the doctor to get involved with you and get set up on our system. That fee, you can add in there for the sales rep, a percentage of that. And when they sign up a doctor, you'll want to give them probably an ongoing revenue from the monthly billing. So out of the 7% you're charging, maybe you give this marketing rep 0.5% of one of that. Well, it might be only just a few $100s a month, but believe me, that gets them excited. And there's nothing that excites salespeople more than telling them they can make a lot of money. We've got sales reps making 6 figures with some of our licensees, so it's very doable. There's the certification again. Again, you're certified as a certified medical revenue manager. Now, before I talk about support, I'm going to address Centil's question. He says, what is the fee involved in adding more doctors and practitioners? One-time startup fees includes adding one or more number of doctors. Yes, Centil, as I mentioned, there is a setup fee, depends on whether it's one doctor or a number of doctors. And these are very reasonable fees, by the way, very reasonable compared to what is out in the marketplace. I'm talking about just a couple $100s for a doctor to get involved and get set up. So that's the only additional fees that are paid to us and our technology partners, but you're not paying those fees. You're passing those on to the doctor. And yes, many of our licensees actually mark those fees up. Now, this is a picture of one of our actual support centers, which is basically out in California. As you can see, there are dozens of people. Folks, across the country, we have over 100 people with our technology partners that support our licensees. And so when you become a part of the nation's largest network of medical revenue managers, That's because we have more people out there to support you than you will ever need, including, of course, our own staff here in Fort Worth. Now, let me show you the support side, can I? Let me see if this works. This is supposed to be a live link right here to it. So if you're looking at something else on your computer, you might want to get back to the screen where I'm showing this, because I'm going to click on this, and I don't know if this is going to work or not. Let's see. Does it? Yes. Okay. I'm going to just show that full screen here so you don't see all my junk on my desktop. And I'm going to enlarge that some if I can. There we go. Look at this. This is our website for licensees. So basically, you'll be logging in as an ABS licensee and have access to all that's out here. Now, let me just click on some of these things and see if I can show you some stuff. Now, here's the news section. Look, this is where we post things constantly. And I'm going to go over here to the right and just kind of scroll down so you can see that, folks, we've been posting stuff on here for a long time. Do you see the dates on the right-hand side of the screen there? Look, goes all the way down here to October of 2014 is when we set this website up. Now, we had another one before that, but this particular one has been around for, what is that, five years now, almost. And folks, this is always good stuff that you'll always have access to. All of the latest stuff that's on here has links, articles, videos, new training webinars that we have for our licensees. That's all right here on the page. And yes, you can go there and go to the previous page and see previous posts. Look, I'm just kind of giving you a behind the scenes peek at what you'll have access to as an ABS licensee. So talk about keeping you up to date on what's going on. There's a getting started section. When you first start, we're going to talk about how to get ready for training, all your business operations, how to set up a business. If you've never owned a business ever in your life, folks, we're going to show you how to do that. We include a website as a part of that $27,000 fee, so we're going to show you how to set that up. Here's all those services that I mentioned earlier that you can go to and find out all about all of it. Here's a whole section on marketing and the things we teach you on marketing. So even though you go through live training with us, folks, you'll have access to all these to rewatch them over and over again and share them with other people that work in your office there. Here's some tools that we have, including those books that I told you about. There's other books I haven't even mentioned to you that I don't have time to go into today. Resources of all kinds. And then there's a search feature if you get lost on the website. Many, many, many things that are available to you there. Okay, I'm pausing that so I can figure out how in the world do I get back to my screen. Let me see if I can do that. I think it's over here somewhere right here. Yes, okay, here we go. All right, so anyway, you'll have access to that. Yes, for life. No, there are no fees for support. Now, folks, be sure and ask other companies that say they do something similar to what we do and ask them what their support fees are after the first year or maybe 2 years. What is that each year? How much is that? What's it going to cost you over the next 10 years? Lots of hidden costs there. We don't have any. Now, folks, just so you'll know, we do these webinars every week at about 4 o'clock Central Time. And I'm telling you about the one that we're going to do next week. People ask us all the time, why do some new businesses fail? Why do people fail when they get in this business or any business? And I'm going to show you how to guarantee that your business will not fail. So be sure and sign up for that. Look, here's what I'm going to do. While I'm talking here, I'm going to put that link that you see there at the bottom in the, I think it shows up in your question box. Let's see if it does. I'm going to put that in there right now and see if that shows up. Here it comes, I think. Did I do that right? I don't think so. Let me copy that and paste it here. Did I do that? Oh boy, I don't know what I'm doing. Sorry. I don't know why I'm not able to put that in the question chat box, but it's not going in there. So I'll figure that out. Anyway, hey, here's what I recommend. Go get the handout. I told you that we dropped the handout of all these slides right there in the handout section. And you'll be able to tap that link in there if you want to. Or you can just go to our website there, absystems.com, and you can sign up for that webinar. This one's going to be a good one, so don't miss that. Let's see. Paul says, I missed the annual income expectation with the business. Paul, I'm sorry, I didn't even cover that today, did I? You see, this is not a get-rich-quick scheme, that's for sure. I would have told you you could make money with it. But we've done that on other webinars out there in detail. Let me give you a feel for that, can I? I think the best way to do that would be to show you here live on our website, because a lot of people ask about that, and that is an important question. So let's see if this doesn't get us there. Yes, okay. So let me see. What do I do here? Somehow I think I share with you this particular window. Okay, there you go. Now we're back to our website, which you see there at the bottom of all the slides, absystems.com. Can you see it right up here? I know it's tiny on your screen, but there it is. I wanted to show you that there's an income potential calculator right here. See it? Income potential, and then medical billing income calculator. So let's fill that out and just see what happens. Now it's already filled out, so I'll just use these numbers that are here. This is assuming you had one doctor. Of course, you could change that to anything you want. Average number of patients that a doctor sees in a day, we've got 20 in there. That's actually low for a general practitioner. 5 days a week. Let's say you're only charging 6%, not 7, like I mentioned, it's 6 to 7 to 8%, depending on the doctor. We'll help you with the pricing on this, but let's leave that at 6. And I've got a low number here too, folks. We need to update all this, but it says for $100 per claim. So let's hit submit and see what we come out with. There it is. Can you see that number right there, Paul? $31,200 each year. That's with one doctor. Now, that may not get you excited. So what I want to encourage you to do is to go back and actually see what that comes out to if you put in, let's say something reasonable, because people ask us all the time, how many doctors can I do without having to hire anybody? Well, it's about 5. It's about a handful. So let's use that number and see what that gets you. Oh, that's much better, isn't it? There you go, 156,000 servicing 5 offices. Now, folks, again, we've got some disclaimers down here. Not everybody's going to make that kind of money. That's why we let you put your own numbers in there, but they're based on real figures from our licensees as to what can be made. And so you can do the math yourself. You'll see it's pretty reasonable. Okay, somehow I have to get back to the slide. I don't know how to do that, but I'm sure it's somewhere right in here. Yep, here goes. See, you're seeing the wizard behind the curtain fumbling as he gets back to the slide. Okay, here it comes. All right, now folks, I told you earlier that we have a money back guarantee, and that's exactly what it is. It's a 100% money back guarantee. Now, how do we do that? Nobody else does it. Nobody else dares do that. You know why? Because we know what we have. And we just believe that when you go through our training, you'll say, you know what? It's everything you said it was and more. And so that's why, even though in 25 years we have given some money back to people, it's been literally a handful over 25 years. So, gosh, I see all kinds of other questions coming in now. I'm not able to access the handouts. Can you forward them to me? Karen, yes. I tell you what. Oh, I see somebody already responded to that there to you directly, Karen, and we'll make sure you get those handouts. If anybody else can't get those from the handouts section there in the control panel, just let us know. I'm going to give you our phone number here on the screen. First, I'm going to tell you that you can check with the Fort Worth Better Business Bureau if you want to see. Since we've been here in Fort Worth for 25 years, they'll tell you we have an A+ rating. That's as high as it gets. And there's our phone number. So be sure and jot that down if you want to call and ask. If you don't know who your business development rep is, just call and ask, and we'll tell you who you've been dealing with and who's been sending you those website emails and things.